Yes.
Hi, I think we're all set.
Hello.
Hello.
Hi, everyone.
Hi, Dr. Kanchan.
Hi.
So let's begin. Prashant, are we ready to go?
Yeah.
So, good afternoon, everyone, and welcome to another webinar by MeraDoc. MeraDoc is a health tech company which offers comprehensive healthcare services, including consultations, diagnostics, labs, and pharmacy through their portal and their website. But to help and provide assistance to people in these tough times, we are currently providing complimentary consultations with our general practitioners to everyone. Kindly log on to meradoc.com to log in and register to use the service. Now, coming to the topic at hand, October is Breast Cancer Awareness Month, and its motive is to spread awareness around the impact of breast cancer. Breast cancer is one of the most common cancers in Indian women, and around 14% of all cancers in women is due to breast cancer. The percentage is much higher in urban areas as compared to rural areas in India. So today, to talk more on this subject and to answer any and all of your questions on this, we have a very special and accomplished panel with us. First of all, we have Dr. Kanchan Kaur. She's an Oncoplastic Breast Surgeon and the Director of Breast Services at Medanta. Next, I would like to welcome Nisha Jamval. She frankly needs no introduction, an author, a writer, a luxury consultant, social entrepreneur, equal rights activist, and a motivational speaker. Finally, our moderator is Parineeta Sethi. She is Chief Editor and Publisher for Globalspa, Peak Life, and Millionaire Asia India. She has been passionately promoting the Indian wellness industry for the past 15 years. So I would like to welcome all these glamorous ladies on our panel, and please take this discussion forward.
So a warm welcome to everyone on this illustrious panel. A slight change that we've had last minute is I'll be moderating because I have with me one of the most illustrious doctors for breast cancer, who's Dr. Kanchan Kaur, and a very brave friend who I've known for several years, Parineeta Sethi, who's actually survived this malaise and been very brave about it. I think you're all excited to hear the journey of Parineeta and also Kanchan, who actually deals with patients suffering this and their trauma on a day-to-day basis. In 2020 alone, there were 2.3 million women diagnosed with breast cancer and 685,000 deaths globally. So we all know, I think all of us, Kanchan, every day come across women, friends, family who suffer this malaise, and it personally touches our lives as women. I don't think there's any one of us who doesn't, feel that sense of fear that we could be one of the victims any day. And I just spoke to a friend yesterday who I called for a tea on Thursday. And I said, Rohini, will you join me on Thursday to a tea I'm hosting? And she said, Nisha, I'm in America going for an operation for breast cancer. That's how often you hear of cases. And worse still, Dr. Kanchan, is the fact that you lose many of these friends due to a lack of early detection. My first question is to you, Dr. Kanchan. Is this more prevalent in India? Is there a stigma or a fear about testing early? And something that you said to me a few minutes ago was something that horrified me, and I must say I was ignorant about, and that is that it afflicts a younger generation as well. One had always grown up believing that the big C is something that afflicts an older, people of an older age. Am I right in assuming that you were trying to tell me that younger girls also get breast cancer?
So hello, yes. Thank you to MeraDoc for organizing this really, really important topic, which is very close to my heart. And thank you, Nisha, for kick-starting, with all the right kind of basic information that needs to go out there, hopefully, to get everybody's interest peaked a little bit more. But when you were talking, two words caught my attention. One was fear and the other was victim. And as long as we have in our minds these two words when it comes to cancer, one is fear of the word cancer, and the second is that somebody who has cancer is actually a victim. These two words are actually the reason why women do not come forward and do not even want to know anything further about cancer, even though, as you said, I think there isn't a single person now who doesn't know someone who was afflicted with breast cancer, be it a relative or a friend. So just building on the statistics that you mentioned, if we look at the Western world, the incidence of breast cancer is 1 in 8 women, which is huge. In India, our statisticians would like us to believe it is 1 in 22 or 1 in 24. But we do know that in metropolitan cities like Delhi, Mumbai, Bangalore, the incidence rates of breast cancer are way higher. So yes, breast cancer is on the rise, and there was actually some data a few years ago which actually told us that in the past 10 years, breast cancer has gone up by 30%, the incidence of breast cancer. Now, a lot of this is also attributed to detection. A lot of times patients weren't detected. Now people are more aware, or we would like to think they're more aware. So we are picking up more cancers. Now, yes, so in India, cancers are increasing at a more rapid rate than we can deal with. But there are a few very sad points when it comes to statistics. Some that we can't change and some that we can. The facts that we can't change is that Indian women are more likely to have breast cancer at a younger age than the West. So whereas in the West, breast cancer peaks above the age of 50, in India, the peak of breast cancer happens between the age of 40 and 50. When we talk of young breast cancer, women under the age of 40, in the West, 6% of all diagnosed breast cancers happen in young women under the age of 40. In India, 16%. So if that wasn't enough, and when a younger woman is diagnosed with breast cancer, it has so many implications. And in a country like ours, when I see a 23-year-old with breast cancer, the parents don't ask me whether she'll survive the disease. They ask me, iski shaadi ho jayegi? Iske bacche honge? So that is the kind of stigma that is associated with the word cancer. So the problems run way deep. Fertility issues, psychological issues, sexuality, so many things come into play. So that as if that wasn't enough, what we also see is that women of African and Asian descent are more likely to have more aggressive forms of cancer. So cancer, breast cancer, is not of one type. There are different types of breast cancer. There are what we call the good-natured cancers, and then there are the aggressive cancers. So in younger women in India, we are more likely to see more aggressive breast cancer, which means that if you actually don't pick it up very, very, very early, the chances of us being able to treat it becomes even more and more remote, as opposed to good-natured cancers where you have that leeway that even if you come a bit late, we have enough options to kind of treat it. So that's where we are with statistics. Those statistics that you can't change. But there are statistics that we can change. And the saddest statistic is that in the West, 90 to 98% women who are diagnosed with breast cancer will be alive at 5 years after their diagnosis. In India, 1 in 2 women would have lost their lives to breast cancer within the first 5 years. That's almost a 50% mortality. And why is that? Not because we don't have treatments in India, because women come late. 80 to 90% breast cancers detected in stage 3, stage 4, where it is very difficult to treat. So that's where we are with regards to statistics. And yes, as you said, Dr. Kanchan, is there a stigma? You know what I feel when I hear patients, what I've realized is that we're not really scared of cancer. What we are scared of is the treatments. हमारे बाल गिर जाएंगे, I will need to lose my breast, hospital जाना पड़ेगा, cost issues. So the fear of treatment, the stigma of being labeled with somebody who's got cancer is way bigger than I think the fear that the disease will kill you if you don't come in time.
I see. So Kanchan, before I move on to Parineeta, I just want to ask you something that you touched upon, which is a common fear among mothers. Does the fertility, get affected? Which is something obviously that plagues the Indian parent.
Yes, and the sad thing is that because in India we are still healthcare sadly is not as standardized. So if the patient doesn't go to a center which deals with the holistic aspect of it, a 22, 23-year-old might end up having chemo and losing her fertility function. So every young patient who's diagnosed with breast cancer and has not as yet completed her family, there are multiple options. They get counseled for fertility preservation. There are ways in which we can preserve their fertility by giving certain injections along with the chemotherapy. And also, like in IVF, you take out the ova and freeze them. We can even do that. So there are multiple options that are available, provided obviously that, these are discussed in time with the patient.
Right. That's very important. And I'm going to come back to that timeliness with you, Dr. Kanchan. But I actually have something more on an upbeat note right now with Parineeta, where she has been a friend for years. And to my utter, shock and surprise, I learned recently because of this very webinar that she herself has been a survivor. In fact, Parineeta, I was wondering where you had disappeared. And I must say, you're a very brave person to be looking even more beautiful after this malaise. I know for a fact, knowing you, that you haven't stopped working, you've been at it. Nothing has changed in your life, in your family, in your day-to-day routine. Before I want to ask you about the experience, which I'm going to come to later, I want to first ask you what made you, so strong? What made you mitigate fear and depression? Because fear, depression, and anxiety, as I know it, and I know Dr. Kanchan may, in a logical, medical way, not agree, but I do know for a fact that mental stress can actually exacerbate a condition like that. So, what did you do to make you so, such a survivor, such a strong, and such a positive, and such a wonderful survivor of this very frightening malaise?
Yeah. So thank you, Anisha, and thank you for having this session. It's something really, really important that everybody should know about it. I agree with Kanchan that the word victim is something that I don't think it should be used for a cancer patient. And I have never considered myself as a victim. But I actually consider myself very, very, very blessed that my cancer was caught at a very early stage. It was a stage 1 when my cancer was caught. So I always say, thank God that happened. And to be honest, I never changed my lifestyle at all. Probably because, like I said, I have been blessed to have caught this disease at a stage 1. Honestly, I haven't had to have any breast removal. I have not even had to have chemotherapy because my cancer had simply not spread at all. The reason I always insist to all my friends is that you must get yourself tested. Doesn't matter if you have no symptoms, because I had zero symptoms. I mean, I would have never even imagined I had cancer because I was leading my life normal. And again, I guess God was on my side. My cancer was detected because I was getting a massage. And the lady who was massaging me said, Didi, mujhe lagta hai ki aapka ek lump hai. And I was smart enough to go to the doctor the very next day. And she said, yes, this looks like there could be a problem. And obviously, I got all the mammograms and everything done. And yes, it was a malignant cancer. So all I did was get the lump removed. And of course, they removed my nodes and stuff like that. The doctor told me that you may get chemotherapy if you want, but I really don't think you need it. But I did radiation. And honestly, I carried on with my life just like normal. The only time when I was off work was actually when a few days after surgery, and of course when because of the node removal, I had that pipe, and also I had to stay at home. But even then, I was working. And interestingly, when I used to go for my radiation, my husband used to tell me that, okay, I'll come along with you. And I told him, why would you come along with me? It's 25 days of radiation. You'll have to leave your work. You won't believe it. I used to actually drive to the hospital myself, get the radiation, and come straight back to work. The reason why I didn't go into depression is because I didn't stop working, and I didn't let it, I never let it engulf me or let myself feel. I won't say that it didn't impact me. I cried for one day because I was like shocked. How can it happen to me? And then I said, what the hell? Why am I crying? I should be thankful that I've caught it so early. If I hadn't caught it early, I had no symptoms and it would have just gone on. So what I always emphasize again to all my friends, please go for a test. And I got the cancer. I was a young cancer, whatever, because I got it before I turned 40. So and I've never let it impact on me. And that's what I always emphasize: early detection, early detection, early detection. And really, it's no big deal. Having said that, it's no big deal. I forget it for 1 year, but I make sure I go for my tests on an annual basis. So I say I take the cancer seriously 1 day in a year, but I don't let it impact me for the balance 364 days, because I carry on with my life like normal. But I make sure that I go for my tests. I follow all the protocols that my doctor has asked me to follow, and I live life king size. That's it.
Great. So Parineeta has told us the little tricks to survival. Stay positive. Thanks to her masseurs,
really, seriously.
She was her messiah. Look for the positives in the situation. Seek out the blessings. Early detection, which saved her. Get yourself, tested regularly. Which is why she was detected. Continue to work. It diverts the mind. Choose your battles. Don't, stress the small stuff. Help friends to detect. The attitude of gratitude is what comes through very strongly in Parineeta's, entire dealing and coping with such a malaise. So there's a lesson to all of us from Parineeta. But coming back to Dr. Kanchan, Dr. Kanchan, correct me if I'm wrong, a woman is detected with breast cancer every 4 minutes, and one dies every 8 minutes due to breast cancer as per data. And 1 in 28 Indian women is likely to develop breast cancer during her lifetime. So is there some way, Dr. Kanchan, I know research is not very, coming forward with this particular point, but are there some ways apart from early detection that can help us mitigate this malaise? And secondly, what do you think is the cause? I know one cause. It's a very painful process unless I'm doing something wrong. Mammograms are very painful. I know that. Is there any other reason apart from the fear of detection, infertility? What is the reason that you find Indians are very belligerent about, testing?
Yeah. So, again, you said something which is my pet peeve. When women come and tell me, oh, doctor, a mammogram is painful, I tell them we will undergo waxing, threading, the pain of childbirth, heartache, 100 types of pains in our lives. A mammogram is 5 seconds of discomfort. 5 seconds of discomfort in a year or once every 2 years, which can save your lives. So a mammogram, I really want to say this. Yes, if you're going to get your breast crushed between two plates, it is going to be uncomfortable. For some women, it may be slightly more painful, and they can then choose to have digital mammograms at centers where they do digital mammography. And when your breast is being compressed, you can actually let the radiographer know that your breasts are more tender than somebody else's, and they can apply slightly lesser pressure. But till now, the gold standard for screening is mammogram. And there are no two ways about it. In the Western world, there is community based screening, which means the moment women turn a certain age, they get invitation letters from the government and their insurance companies to say, you must come and get a mammogram done now. And we know, irrespective of whatever controversies we get into with mammogram and radiation exposure and this, that, and other, the statistics are there for everybody to see that mammogram saves lives, because it is common sense that if you detect it early, it's going to save your life. And when Parineeta was talking, she was talking about how she had no symptoms. And I really, really, really want to put this message forth, because at least 10, 12 times a week, I hear women come and tell me, Dr. Kanchan, I felt this lump a year ago. It did not hurt, so I thought it was normal, but now it is growing. It is still not hurting, but I thought I should get it checked. Matlab, this dialogue is completely blows my mind off, that if you see an extra hair on your forehead, you are going to take action to remove it at the earliest. But you feel a lump in your breast and you hear about cancer day in, day out. How can you not take it seriously? So, really want to send this message forward, that cancer is painless in more than 95% cases. It is symptomless sometimes, even if it has spread in the body. So, your only true protection is, if you're 40 and above, is to get regular screening mammograms, that the cancer gets picked at a stage when it can't even be felt by the hand, and that is stage 0 and stage 1, which is fully treatable and potentially curable. That's really, really, really important as a message to kind of
I want to interrupt you here to make a point to all the uninitiated. Are you saying that the mammogram has to be done once in 2 years? We'll just reiterate that point.
I was just going to come to the screening bit like next. So 40 and above, we strongly recommend mammograms. Now, whether they should be done once every year or once every 2 years is something that even the doctors can't stop debating about. If you are in the US, you're going to have it annually. And 2 years ago, even in the US, 2 different bodies got into a fight saying, no, it should be once every 2 years, and one saying it should be once a year. In the UK, where the government pays for the mammogram, NHS, it's once every 3 years. So what we say, we have to meet at some ground which is sensible. So at 40, when you have your first mammogram, if your doctor feels that you have very dense breasts, or you have a chance that you could make something sinister later on, then it is sent. And we know that in Indian women, breast cancer peaks between 40 and 50. We recommend that you get a mammogram on a yearly basis between 40 and 50. Because Indian women have dense breasts, the mammogram sometimes on their own might not be conclusive, and you may need an ultrasound. But an ultrasound alone is not a screening test for the breast. You still need a mammogram, even if your doctor tells you, oh, it's very dense and we can't see.
Let me interrupt you again and ask you that, would you also advise tumor markers along with ultrasounds and mammograms?
I'm very glad you asked that question, because it wouldn't have had come to my mind. There is zero role of tumor markers in breast. So we do not randomly do tumor markers at all. The only proven screening tests, the biggest one is your own hands, followed by the mammogram and the ultrasound. So under the age of 40, even though we talked about young breast cancer being very common, there is no screening test that we recommend as a routine, because it's still not as common as it is above the age of 40. So what we recommend, and I must tell you this funny story. I used to, when I came back to India, I was so distressed to see advanced cancers. I started going out doing lectures with women 40 and above, 50 and above, and I realized one woman once got up and said, मैंने पूरी उम्र भर कुछ नहीं किया, अब क्यों मैं करूं? And I realized I was addressing the wrong population. So I started going to colleges and schools. I started telling young girls that the moment your breasts develop, you need to be aware on how to check them. Luckily for us, breasts are external organs. You touch them every day. So if it is a habit from the day you make your breasts, you will, examine yourself once a month, every month, always. Because unless you know what is normal for you will not know what is abnormal. So you can't just suddenly decide, oh, I'll check myself today and I'll find a lump. Because you need to know what the normal feel of your breast is. So girls as young as 15, 16 should be taught to self-examine once a month, every month. And I've realized when I go and tell a 16-year-old, she drags her mom, her nanny, her bua to clinic to have their mammograms done. Because they understand the importance of this. So just to kind of quickly recapitulate, under the age of 40, every woman should self-check once a month, every month, preferably 5 to 7 days after your periods have finished, because breasts are soft and less tender. Any doubt you have, please do not consult Dr. Google or Baba Ramdev or any random person. Go to a doctor. Very, very important. If you feel after going to your general physician or your gynecologist that you still are not convinced, please seek out a breast specialist or an oncologist. Always do that, okay? From the age of 40 onwards, we strongly recommend mammograms, and when needed, an ultrasound along with the mammogram and an annual physical examination by your doctor, so that the doctor can also examine you, because there are 10% cancers that are missed on a mammogram. So you need to close the loop with a physical examination, a mammogram, and an ultrasound. And please remember, just because you had a mammogram today doesn't mean you can't develop a cancer 3 months, 4 months down the line. So don't relax. That monthly self-check is extremely, extremely important.
So great that I think that's educating a lot of women out there. And I hope women are hearing Dr. Kanchan, who's I find extremely articulate and very easy to understand. So it's use your hand, self-examine, mammogram, ultrasound, and tumor markers do not work on breast cancer, but I'm assuming they do on other cancers.
Others, yes.
But I want to come back to Parineeta and ask her, Parineeta, how did this experience, this very, it's earth shattering for a human being to suddenly, because the big C is so feared. How did you, take your life forward after this? How did you, what are the changes you made? Dr. Neeti Raizada, the director of medical oncology and hematology in Fortis Hospital, says that, there are many ways one can help along the process of when you get cancer, and nutrition is extremely important. Did you change your diet into a low-fat diet? Did your calorie consumption change? Did you go more towards fruits and vegetables, like Luke Cotino suggests, that non-vegetarian is a harakiri for a cancer survivor because of the acidic atmosphere creates in the body? What were the lifestyle changes you made, and what do you advise to all of us women dealing with that one fear, the big C?
Okay, the first thing I want to say is, you said that a mammogram is painful. I've been doing one for the past 16 years, every single year. It really isn't painful. What Dr. Kanchan said, it's uncomfortable, but it's really not a big deal. So mammogram is something that one must do. So I do a mammogram, I go to a doctor every year, and I obviously do the ultrasound also. Now, to come back to the lifestyle changes, basically the lifestyle changes is you just have to lead a healthy lifestyle. I haven't really done anything that a normal person should not do, in the sense that I make sure I exercise. The first thing my doctor told me is that please make sure you don't put on weight, because if you put on weight, the chances of it coming back are more. Because like you've all said, dense breasts have a tendency to get more cancer. So I exercise, I follow a routine where obviously I eat healthy foods. But to be honest, I haven't, because they talk about certain foods being good for cancer and certain foods not being good for cancer. So I follow them into my lifestyle as a normal routine, something that I think everybody should do. but I haven't really gone ballistic over it, that this is good for cancer, this is not good for cancer. Like I said, I really do forget that and I consciously make that effort to forget that I have cancer for 364 days in the year, because I don't want it to, kind of define my life. So half the time, honestly, I have even forgotten that I have this problem. But I just lead a very healthy lifestyle, and I try to do what I suggest everybody should do. Now, I have a very interesting thing that I want to tell you, that when I used to go for my radiation, I did tell you that, I told my husband, please don't drive me to the radiation. So I used to make sure that I put on my full makeup and I'm ready for my office when I go for my radiation. I used to go early in the morning. So when I would go for the radiation, the other people sitting over there waiting for the radiation would ask me, "Aap kisko leke aaye ho radiation ke liye?" And when I would tell them, "मैं खुद करा रही हूँ," they would be shocked. They said, "नहीं नहीं, आप झूठ बोल रहे हो, आप अपने लिए थोड़ा ना आए हो." I would say, "देखना, मैं ही जाऊंगी अंदर, मैं ही radiation कराऊंगी." So the most important thing that I did to myself was I told myself, "Listen, it's no big deal. Don't treat it like a big deal and stay positive." And, honestly, I did not even tell my children I had cancer, because for them, they were young at that time when I got this problem. And I just decided not to tell them about it. I didn't tell my mom and I didn't tell my children, because I knew the minute they hear the word cancer, they will go ballistic. So my children only got to know that I had cancer once they were grown up enough to understand it. And that too, because we were talking about it to somebody. So the one thing that I did was to keep a positive attitude, to continue leading my life as normal as possible. Now, I'm not saying that you don't take it seriously. Of course, you have to take it seriously, but you don't have to let it impact your life. Continue as normal, work, eat a good, healthy diet, and just be positive. And that's what actually, like I said, I never let it impact my life, except for that first day when I was detected, when I couldn't stop crying, because obviously the very word cancer, I said, like, how can I get it? But day two, and I decided, no, I'm not going to let it change my life, and I'm not going to cry over it. Whatever has happened, just be positive about it. And it's a very interesting conversation that my friend from Dubai flew in when I had to go in for my surgery. So when I was being wheeled in for my surgery, I just told her, "Zara meri shakal dekh, am I looking fine?" So my husband said, "Tu pagal ho gayi hai? Why are you concerned about how you're looking?" So I just wanted to make everybody else positive and all. I said, "Can I put on some lipstick when I go in? Maybe the doctor is handsome." So it was just a joke I created. My husband couldn't believe that I was taking it so lightly. I wasn't taking it lightly. I was just trying to make sure that the people who were outside the surgery don't stress about it, because I was going to go under anesthesia and I wasn't even going to know what happened. But my family who was outside and my friend were the ones who were going to stress about it. So I just say, keep a positive attitude. Make sure you detect it early, because it's difficult to keep a positive attitude if you get detected late, obviously. So, I keep emphasizing that again and again.
Can I just come in here for 1 second?
Yeah.
Parineeta, that's so heartening to hear, because when I sit in clinic and counsel patients, I tell them one thing, is that the battle of cancer is 50% in your mind that fights it, and 50% is what your body fights. If your mind wins the battle, your body is never, never, never going to lose. And that positive attitude, I tell my patients, if there's one thing that I have learned outside of my textbooks, sitting here in a clinic, is that the patient who walks through my door and says, "I am going to overcome," will overcome even if she's stage 4, and those are the medical miracles we see. Whereas the patient who walks in scared and worried and sadly doesn't have enough support around her are the ones who, despite the best treatment, sometimes don't do well. So 3 cheers to you, Parineeta.
Thank you. I say I was lucky. And of course, I had a positive attitude, and I had a lot of positive people around me who kept supporting me. And I guess I am intrinsically a person who keeps myself positive. But power of positivity is the most important thing.
I totally agree.
So what comes through is the attitude of gratitude, staying positive, looking good to feel good, and asking yourself, why not me, instead of asking why me. It's all about the mind, and I think that comes through very strongly from both Dr. Kanchan and Parineeta. Yeah, and also, of course, that in an age of processed foods, unhealthy snacks, which have become an important part of our diet, there is a high risk of developing chronic illnesses also. And adults and kids alike have become more comfortable with the sedentary lifestyle. So, what Parineeta says about exercise becoming such an important part after cancer, I think each and everyone hearing this should understand that it should become a part of life before cancer, and lead, a sedentary life we all know leads to unhealthy weight gain, which is also a cause for the dense breasts. You curb breast cancer risks when you watch your scales, when you eat right, and of course we all know avoid addiction in form of smoking and alcohol. These lifestyle habits are extremely unhealthy and increase the risk of cancer and chronic other health conditions. But Dr. Kanchan, because mammograms are your pet peeve, we didn't address the first part of what I asked you. With Parineeta, we've gone through the journey of the aftermath. But with you, I wanted to ask you, apart from what I've mentioned about health, processed foods, looking at your scales, keeping a positive state of mind, is there anything else you'd like to add about what could we do beyond these things to mitigate the risk?
So just before I answer that, just want to clarify a point on density of breasts. So density of breasts is something that you are born with. It is a woman's mammogram is like a fingerprint. There will be no two same mammograms. So it's what you're born with. Whether you are overweight or you are the right weight does not affect the density of the breast. What being overweight does is that in post-menopausal women, having more body fat leads to more circulating estrogen, which is the female hormone, which then increases the risk of developing breast cancer. Density of the breast has nothing to do with exercise, diet, or anything at all. It's what you're born with. You cannot change the density of your breast. So now coming to the question that you asked. Now, sadly, we sit here as experts and we know very little about the why and about how to prevent. There cancers like cervical cancer, you can take a vaccine and reduce the risk. Lung cancer, oral cancer, don't smoke, don't chew tobacco, and you won't get that cancer. But with breast cancer, it is multifactorial. There is only one definite cause that we know, which is the BRCA positive gene, which Angelina Jolie had, which means that you are genetically predisposed to developing breast and ovarian cancer. So those are the patients with the family history risk and a gene positive, and we deal with them totally differently. 90% cancer, 85 to 90% cancer happens in those women who have no family history of developing breast cancer. And the reason for that is an intrinsic tendency to develop cancer, which we as doctors have as yet not pointed out. And second, very importantly, are environmental factors, which are in your hand and which you can control. So diet and exercise, yes. In fact, alcohol has been linked to increased risk of developing breast cancer. And considering that Indian women are taking on to alcohol in a very big way, a little bit of a word of caution there about alcohol consumption. Having kids at the right age and breastfeeding them definitely gives you a level of protection. Saying that, it doesn't mean that if you don't have kids and you don't breastfeed, you will develop breast cancer. But yes, your chances are slightly higher. So breastfeeding, again, one of my biggest pet peeves nowadays is that young girls who are having babies or women just say, "Hame doodh nahi aa raha, I'm not getting milk." And they're not breastfeeding. So please understand, breastfeeding is hugely protective. So doing that is very important. We can't control when we have kids. We're all now career women. We don't want to have kids when we are 23, 24. But ideally, under the age of 30, if you can complete your family, it does slightly reduce the risk. There are other things which are hidden chemicals, and to a certain extent, you can control them, and to a certain extent, you obviously can't. And I'd like to tell you all about the Macmillan Breast Cancer webpage, which is a UK-based Macmillan. It's a cancer-linked. They support patients who have cancer. They have a lovely chart on their website which says "Ditch the junk." Okay. And you know what the junk is? You'd be surprised to read. It starts with your normal toothpaste because it has chemicals that can cause cancer. It goes on to your cosmetics. Now you find cosmetics which say very bold, in bold letters, paraben free. Till 5 years ago, nobody told us there was something called paraben in our cosmetics that could cause cancer. You go to buy plastic bottles to put water in your fridge, and there are big stickers saying BPO free. What is this BPO? Till 4 years ago, nobody told us there was something called BPO in your plastic bottles. So what we have to understand is that we are surrounded by chemicals that are called endocrine mimickers. Endocrine means your female hormone. Mimickers mean they mimic your female hormone. And when they come in your body, they can come through your cosmetics, they can come through the insecticides and pesticides in your food. And these can then disrupt your hormonal cycle to produce cancers like prostate and breast. And when I say this, then the patient say, "Fir what should we do?" Then your only protection is khana chhod do, saans lena chhod do, pani peena chhod do. That's the only way to protect. But be sensible. Be very sensible in the choices you make. So if you have a little kid and the child says, "Mummy, I'm hungry," don't give them a packet of chips or a packet of kurkure. Find a carrot, peel it, and give it to them. Give them good habits from when they are young, because it is all of this processed food industry that has caused the spurt in all the diseases that we are seeing. So please understand that if you try to live your lives like your Nani Dadi lived many, many years ago, we will actually do ourselves a favor. Very quickly, I don't know if any of you is as old as I am, but I do remember that when we had to have chawal or atta in the house, we had to either, put it through a sieve to take out the kide, or somebody would sit and remove the little black and white, Ajkal, there are no insects, pests in your food. Why? You bring vegetables and you buy the shiniest, same looking apples, the shiniest, same colored bhindi, and that when you cut, there is never any worm in it. But that is not natural. So if you can go organic, I know again that is a big debate, but try to be natural, eat local, eat seasonal, eat fresh, stay away from processed foods. And it's very easy to say, try to lead a stress-free life. All of us have stresses. It's how you deal with your stresses, which is very, very important. And also, before I forget to add this point, is about the sleep cycle. And I think especially with COVID and our phones and this blue light surrounding us all the time, it is so important to understand that our body runs according to a rhythm called the circadian rhythm, that we need to have sleep in the dark, not with the light on, not with the blue of light of your phone on your face. You really, really need to understand that sleep pattern is important. In fact, a nurse on the NHS in England took the NHS to court because she did night duties for 10 years and got breast cancer. And she was able to prove in court that because I had a disrupted sleep cycle, I had a disease come in my body. So, it's actually a bit funny that we talk about these things, because these should come naturally to us. They came naturally to our grandmothers. You wouldn't have to tell a village woman to say, "Subah utھ ke aap exercise kijiye." Well, her whole day is exercise, and eating fresh and healthy and making the right choice in food, in cosmetics is extremely important. At the end of the day, we can't tell you why it happens, but I can honestly tell you with my hand on my heart that if it happens early, I promise you it is treatable and it is curable. It needs to be picked up early.
Yeah, exactly.
Fabulous. I think that was so all-encompassing. And Kanchan is going to bring change to all our lives. These are such important points. Look at your
My kids hate
toothpaste.
me. My kids hate me. They go to a market, one looks at something and then the other goes, she's going to turn the packet around and read what's in it. We are never going to be able to buy this. So, yeah.
Yeah, so paraben-free cosmetics none of us knew about. Plastic bottles, insecticides and pesticides, don't be so against them. Buy organic. Be sensible about your choices. Processed food, say no to processed food and go for natural, real grain, real foods. And go local, go seasonal. And most importantly, sleep cycles, very, very important. And of course, what my pet peeve is that Indians don't seek mental, health doctors. They don't go and address mental health. They don't address anxiety attacks, panic attacks, which have become so rampant. And evidence from epidemiological studies indicates that mental illness is associated with elevated cancer risk and poorer cancer outcomes compared with the general population. In fact, a rigorous analysis of studies that followed women for 10 years showed that there was a 50% increase in the risk of breast cancer in women who had experienced a stressful life, discord at home, financial problems. And there's a twofold increased risk in those who experienced the highest stress levels. So I would say my little contribution to this is that any problem at home, any stress, seek help. Don't get fraud prescriptions. I've seen women get addicted to benzodiazepines. Today Aryan Khan is caught with an addiction. It's out there and it's open, but there are a lot of women over 40 who actually get addicted to benzos and sleeping pills without consulting a doctor, and it becomes a lifestyle for them. And it's horrific to see them get fake prescriptions or even get prescriptions from doctors rather than seeking help from psychiatrists, from counselors, making support groups. So that's my, understanding in my counseling career, in the help that I give in marriage counseling, because I've been writing a relationship column for the last 20 years. I find a lot of women writing in and taking Ativan, taking Compose, Restil. It's frightening to see self-medication and addiction to over-the-counter drugs. I think this has been a very enlightening, and Dr. Kanchan, we could go on and on and on. This is something that, plagues us all. And I hope, I must first thank Shalini Vij, who's put all of us together, working tirelessly night and day on this seminar. I actually got worried, Shalini, this morning, wondering, am I supposed to do some prep? Because all this is so natural to us. We live with it. We are seeing it in our friends, and we are seeing it in Parineeta, who's come out of it triumphant. But thank you, Kanchan. I hope I can meet you when I'm in Delhi next. You're such an articulate and lovely doctor. You challenge the whole, concept of a doctor dealing with such a worrisome malaise. Thank you also, Parineeta. You've been a friend for years. You've come out being a valorous hero and inspiring all of us to take a little more care. People like me who avoid mammograms, to go out. I think I'm going to do it tomorrow.
You better. You must.
I was about to say that.
Yes,
you must.
And this fight and flight reaction that we have, to let that go, catch it by the horns and go and bell the cat of cancer. Thank you so much. It's been a pleasure talking to all of you. And thank you, Shalini Vij and MeraDoc, if I'm saying that right. Thank you, MeraDoc and Dr. Adit Mathur, for having me here. A wonderful day to all of you.
I just want to say one thing to Dr. Kanchan. So, Doc, if you ever need for me to talk to any of your patients who are depressed, please feel free to talk to me. I will definitely come and make them understand that it's not really a big deal. You can live with it, and you can live happily with it.
Excellent. Thank you. Thank you.
So, thank you, everyone. Thank you to our panelists. So the key take homes for today have been like, first of all, it is very difficult to pinpoint a cause to prevent breast cancer. Most people diagnosed do not have a family history, they do not have any specific pinpoint triggers to, say that you are at higher risk. Secondly, timely screening saves lives. So like Dr. Kanchan mentioned, getting a mammogram every year, every 2 years after you turn 40, educating young women who are undergoing adolescence, developing how to do a breast self-examination, that is the key. So ultimately it is in your hands, early diagnosis. Third of all, a positive diagnosis does not mean the end of the world. Newer treatment options are constantly being developed. And now, as Dr. Kanchan has said, even stage 4 cancers are now treatable. So it is not the end of the world. It is not a death knell like people used to say that you have cancer, oh my God, you're going to die. So it is not there. And lastly, taking example from Parineeta, a positive attitude always leads to better outcomes. If you have a positive outlook on whatever illness you have, the outcome is always going to be a good one. You go through life with a positive attitude, I'm sure that you will be free from illnesses and you will be a better at the end of it. So I would like to thank all of our panelists. Thank you for sharing your valuable time, Dr. Kanchan, Nisha, Parineeta. Thank you so much. I would like to thank our partners, Festival of Hope Foundation India, Heart Care Federation of India, IP Global, and on behalf of Team MeraDoc, thank you everyone for attending this webinar. And if any queries, you can please go to our website, post your questions or queries. We'll try to get them answered by our panelists for you. Thank you, everyone. Thank you so much.
Thank you, all of you. Bye, guys. It was really nice talking to you all.
Lovely.
See you soon.
Everyone, take care. Bye.
Thank you, Dr. Kanchan. Thank you, Parineeta. It was a pleasure speaking to you, Dr. Adit. Thank you.
Thank you.
See you again.
Thank you, Nisha. You did this beautifully.
Beautifully.
Thank you so much.
Nice.
Thank you.
Excellent.
All right. Bye, girls. Bye.
Bye-bye.
Bye.